How would you like every time you went to the doctor because you were sick, all of your healthcare decisions and choices were mandated and dictated by the government? Well, President Barack Obama wants to nationalize healthcare, which means healthcare will be controlled by the government. The United States is all about freedom of choice, and why should we have to have the government make our choices for us for healthcare of all things? And I don't know about you, but I would not want the government being in any control about my healthcare. I would want to make my own decisions and have my own treatment plans for myself. Well, this nationalization will affect everyone, all the people in the United States, because everyone needs healthcare. Our kids need healthcare. Our parents need healthcare, and we will need healthcare once we're older and geriatric and can't take care of ourselves. Well, I'm going to show you what problems we will have facing nationalizing healthcare, who it will affect, and what we can do against it, and if nothing is done and we do have nationalized healthcare, what will be in the wake of this problem. Well, first I want to start with the ugly truth, the problem, of course, nationalization of healthcare. First, it will eliminate private healthcare businesses. The healthcare that a lot of Americans do have today are private healthcare businesses, and all of them will not be able to compete with the government because they have better prices and they have a better control of healthcare, so they just won't be able to compete and they'll go out of business. A quote from Patrick Yost states, "If we were to do that, some 20 million Americans would lose employment-based health insurance, according to some estimates." So people that have health insurance through their jobs, they will be lost because the government now controls healthcare. And which isn't fair, because a lot of Americans today have given up wage increases because the rates of healthcare have been rising. So they've been giving up wage increases for nothing if the government controls healthcare. Again, we will not have any choice of healthcare for what we will have, for what kind of treatments we want. We won't be able to have our first picks for brand name prescription drugs. We will have to have mandated healthcare by the government. And countries like Canada and United Kingdom that do have healthcare, that have nationalized healthcare, have they'll have to go into the doctor and they'll have to wait for diagnosis treatments like CAT scans, MRIs. They'll have to wait for months and months because it's not an easy going to the doctor thing. It's going to the doctor and then the healthcare is decided by the government, and the government will decide whether or not they want to treat this healthcare. So they're very dissatisfied because of how long it takes to get healthcare, and also this program is very expensive, and we're already going through tough times through the recession, and the government just passed a stimulus package to help the government, so we're already in major debt. And a quote from Jerry Geisel says that far from saving money, the proposed reforms would add $239 billion to the national debt over 10 years. So we're already in a recession. Why spend more money on a plan that I think is bogus? And also, this will make the middle-class citizens pay more. The average Americans pay more because they have to cover low-income people that can't afford health insurance. So they'll have tax surge on middle class or the high class. Who this will affect and what will happen? Well, a quote from David Haugen states, "Rising healthcare costs are offset by coinciding advances in medicine. Because these advances are improved quality of life and generally increased human longevity." So basically, even though there are high rates for healthcare in America, that it's worth it because longevity will increase because there's health advances in medicine. So it is worth it in the end to have high rates and have our own choice of healthcare because it just increases our human life in the end. But the way we can fight this is just information is a weapon. like once we're informed and know and be aware of this policy, because we can speak against it, or even like go to representatives that represent our region or our city, that we could tell them that we're not for nationalizing healthcare. Another quote by Kenneth Yost says, "The only way we can achieve universal coverage is to require everybody to either purchase private insurance or enroll a public program." And that is for nationalized healthcare. That's a quote, for nationalizing it. And so that's just saying everyone needs to join a public program to get health coverage. So if everyone is involved, why can't we all make the choice to not have nationalizing healthcare, to all make the choice of not doing that? What would happen if nationalizing healthcare did pass? We may not get sufficient healthcare, and you may be dissatisfied because you have to wait, and also you won't get the prescription that you want. You'll get your second choice, or just the mandated government choice for you. Choices that you would make between your doctor and you, the patient, would be made by a panel of government officials or just a federal level, and this panel would tell you whether or not you need a health care, and which isn't fair. Also, a quote by Scott Atlas says, "People in countries with more government control of healthcare are highly dissatisfied and believe reform is needed. More than 70% of German, Canadian, Australian, New Zealand, and British adults say health system needs either fundamental change or complete rebuilding." So countries that do have nationalized healthcare, they're not satisfied and they think that choices are better because they are not getting the satisfaction through their government that say they will take care of them for the healthcare. So in conclusion, America should be the land of the free, and we should be able to make our own decisions and own choices. We shouldn't be having stuck with a government mandated decisions on our health care. So this bill is trying to get passed through Congress, and we should stand up and say that we do not want nationalizing health care. We know that our healthcare system is not fully at top running, but we can do other ways instead of nationalizing health care. So we need to make our own choices and stand up, because this is America. Thanks.